Hello, you're welcome to the program Understanding Infertility with Dr. Abayomi Ajayi. Now the next question to ask is, how do we treat infertility? I think this is the million-dollar question. Well, we can look at this from three main points. We can talk about drugs to treat infertility, we can talk about surgery, and then we can talk about assisted conception. When we're talking about drugs, we can look at it from the male and then the female. I'm sorry to say that in men, drugs have very little impact in infertility. One thing I want to say is that there is no drug sperm booster as of 2016. For drugs in the woman, yes, when the problem alone is that the woman cannot ovulate, then drugs can be of tremendous help here. Of course, we can use tablets and then there are injectable drugs for ovulation induction. And then surgery. This used to be the cornerstone of treatment before. But we now know that the success rate of surgery for men and women with infertility is abysmal. For the man, we talk about varicocectomy. Well, that's something that nobody can really swear by. Sometimes you get some results, sometimes you don't get any results. So this is not consistent. And so many studies have been done that shows that the sperm parameters improve for some time and then it comes down. But really the function is not in any way improved. Now, for the woman, we used to do a lot of tubal surgeries, but we now know that tubal surgeries and infertility is seriously, the success rate is in the neighborhood of 5 to 10% from all studies that have been done all over Nigeria. And therefore, yes, there is room for tubal surgery, but in very selected patients. These are patients that you have done laparoscopy for, and you can see that the only thing that you need to do is just probably get rid of some flimsy additions, scar tissue, which we can then do. But majority of the patients will benefit from assisted conception. Now, we can look at assisted conception and say that there are procedures that aid or increase the chance of conception per cycle of treatment. Now, that is, for the cycle in which you're applying the method, then there's increased chance of getting pregnant. The three categories of assisted conception comes from how complex they are. For me, let me say that for you, for a particular procedure to qualify to be called assisted conception, it must have three characteristics. The first one is that you must use drugs to produce more than the normal one egg that a woman produces every month. There must be a method to bring the two of them, the egg and the sperm, together, and then there must be also a method of sperm preparation. So the egg, you prepare the egg, you prepare the sperm, and there must be a method of bringing them together. Depending on how complex this method of bringing them together, that's when we talk about whether it's intrauterine insemination, in which is the most basic way of bringing them together, in which the fertilization still takes place in the tube, to IVF, in which you bring the sperm and the egg together in a tube, or to ICSI, which is like the zenith, where we call manipulation, in which you actually inject a sperm into an egg. All this we're going to take in subsequent episodes of this program. So just join us every week, and definitely before, in a number of weeks, you almost know as much as a doctor who is specialized in reproductive endocrinology. There are support groups all over the place, and we're going to introduce you to one of them in the course of this program. And of course, we expect IVF clinics also to have qualified counselors that can help you as you go along this journey. Thank you very much for joining us on the program today. Always remember, together we can conquer infertility. My name is Dr. Abayomi Ajayi. Catch you.